Patient name, Emily Nelson, 6-year-old white female. Findings. The patient is vomiting with severe dehydration and lethargy. Skin turgor is poor. The patient complains of dizziness when sitting or standing, and weakness with signs of hypotension. Vital signs. Oral temperature 100.5, blood pressure 80/40. Respirations are 16 and shallow.
I have this tummy ache, honey. Let's go talk to the doctor, okay? Daddy's out there right now.
It's too soon to know what the problem is, but I want to admit Emily right away for a series of tests.
What do you mean right away, doctor?
This morning.
It's that serious?
I don't know, but I don't want to take any chances.
Well, whatever you think.
Can we get Emily into the university hospital?
Let me check. There are beds available in pediatrics.
Good. Why don't you take Emily up to the hospital? I'll be over there to see her soon.
We're on our way. Thank you.
You're welcome.
Patient name, Robert Daniels, white male, age 48. Forensic substernal chest pain, breathing down his left arm and his jaw. Patient states that he shortness of breath and is nauseous, not vomiting at this time. The skin is cool, pale, and diaphoretic to the touch. You got a heart rate of 120.
Mr. Daniels, you're going to be okay. Your wife is on the way.
Yeah, right. CPK, MB, and ADG is now. How much nitro has he had?
Is the patient's medical record up yet?
What's his pulse? What's his pressure?
Got a pressure of 160.
If there's a previous EKG listed, let's see it and compare.
Be quiet, sir.
Mr. Daniels, you're going to be okay. Your wife is on the way.
Be all right.
So much pressure. 6 milligrams MSI now. How's his pulse? What's his pressure?
150 over 80, 180.
Pressure's coming down good.
Dr. Grant, I have the patient's physician online.
Hi, this is Jim Grant.
Susan Armani here. I understand you have one of my patients in with a possible MI.
Yeah, Robert Daniels. Take a look at his echo.
Okay, I've got it.
There's definitely akinesis in the anterior wall, and he has ST elevation as well.
You know he had a cath last year. That should be in his record.
Got it. The LAD could be the culprit. Let's see the intervascular echo.
Looks like a high-risk plaque. He's probably occluding right there. Listen, Jim, I'm on rounds today, so I'll be in to look at him in half an hour.
Good. We'll start him on thrombolytics.
Good morning, Charlie.
Good morning, Frank.
What's going on?
You have 2 messages.
Okay, play the first message, please.
Frank, here's the agenda for this afternoon's Administrative Council meeting. We'll be discussing next year's capital improvements. So if planning has any new ideas, make sure we talk about it in advance. Give me a call when you can.
Store, play the second message, please.
Hi, Frank. I want you to know my staff is giving me grief up here about our cath labs. They can't get their elective cases done until 8 or 9 at night. We simply need another cath suite, Frank.
Yeah, everybody wants something.
Call me when you get a minute. Thanks.
Charlie, search internal sources, cath lab volume, historical and projected, cath revenues, and cath overhead.
Financial data locked. Please enter your security code.
Yeah. We'll also get data on that new clinic we're looking at, Oak Hills.
Okay, ready. 1, 2, 3.
Here you go, Emily. Let's get you all comfortable now.
I don't understand. We've never seen her this sick before.
Did she do anything unusual?
She went to Grandpa's farm.
We picked berries. Did you tell that to the doctor, Emily? Will you tell me?
We picked berries in the woods.
And what else did you do?
I got sick.
Hi, Susan. George Hanlon here. I'm covering cardiology this morning. I've looked over the echo on your patient, Daniels. It certainly indicates hypokinesis of the anterior wall. He's been on thrombolytics an hour now, so I'm hoping to see some reperfusion. In the meantime, give me a call.
Let's see how Mr. Daniels is doing. Very good. Looks like the anterior wall is moving again. I'd like another set of electrolytes.
Okay.
Mr. Daniels, how's the chest feel?
Better now.
What's going to happen?
He's doing much better. For now, he should just rest.
Thank you.
Hi, this is Tom Miller.
Tom, this is Hal. You wanted to consult on your patient, Emily Nelson.
Yeah, Hal. Emily's labs show no infectious etiology, but her liver function continues to deteriorate.
Well, this berry picking. We can see a fairly high suspicion now for mushroom poisoning. Now, look at this. I've asked the nurse to get an ID from Emily on these if she can.
Good. I'll also order a screen for amatoxins.
Oh, a word of caution. Tom, now, if this is Amanita, liver failure can be quick, and the mortality rate among kids is over 50%.
I'll be over to the hospital soon, Hal. I want to thank you.
Okay. I'll keep current on her labs.
Good.
Emily, I've got some pictures of mushrooms that I'd like you to look at. Do you think it could have been this one? No. How about this one? Are you sure?
Hello, Charlie. What do you got?
Good afternoon, Frank. I have retrieved the data you requested.
All right. Projections. Not quite enough for a third suite. Of course, we might grow into it if the clinic purchase goes through. Charlie, email a message to Sandra Smith, Chief of Cardiology. Hi, Sandra. I'm sending you the data that I've worked up on the cath lab problem. Our figures show that you don't have the patient volume for a third lab yet, but don't give up. I'm working on another angle, and it just might pan out. Bye now. Let's see what Oak Hills has to offer.
I don't understand what's going on.
He's coming back.
No.
Mr. Daniels, where does it hurt?
Right here.
Okay. Dr. Armani is here. Take some slow, deep breaths. You're gonna be fine.
Oh.
Start a nitro drip, 30 micrograms per minute. Page Dr. Hanlon, and I want stat electrolytes.
Sort of.
Stand clear.
Dr. Hanlon, Mr. Daniels had an episode of VTAC. We cardioverted and he's back into normal sinus rhythm.
Okay, it looks like he's re-occluded. Let's get him to cath lab stat, and I'll meet you there.
Emily's hepatotoxic, and the Amanita did test positive. I've notified the CDC and the State Health Department.
How bad is she?
Not good. The PET scan shows progressive liver damage. In fact, I've got her listed with the National Registry for possible transplant.
When would she need it?
Soon. However, here's something interesting. 2 Amanita cases in Oregon were treated with forced diuresis and pulled through. Of course, Emily's going on 30 hours now, and I'm not sure she'll respond. But then I found this from Jean Leclerc in Geneva. He's the leading expert on toxic mycology, and he's trying a whole new protocol.
We should call him.
I did.
So, having studied your patient's PET scan, I think she can be helped by a procedure we have begun to use in Europe. Here is an article on the treatment protocols we have devised. Though this is a new therapy, it has proved quite effective in several cases already.
I went ahead and started Leclerc's treatment. I hope it works. There's no telling if we'll find a liver in time.
Softer, cleaner hand. He sat up and began to groom his whiskers. Always a good performance.
Take a long, slow, deep breath in through your mouth, Bob. Real deep, real deep.
Couple more pictures, okay?
We're almost done.
Sure feels a lot better. Really tired.
There's a little plaque right there. Let's get that and we'll wrap this up. Record.
Okay, flow looks pretty good. How you feeling, Bob?
Great. Somebody just tell my wife everything's okay.
In multiple suite hospitals, 74% of patients come from outside clinic referrals.
My recommendation is twofold. First, we should begin construction on a new cath lab.
But how can we afford it, Frank, if we can't even fill a third suite?
There's an answer for that, Gordy, but I want you to see this first. Now, this is what overcrowding in our 2 cath suites is costing us right now. Over $500,000 a year in overtime, patient diversions, length of stay deficits. By adding a 3rd suite, we can eliminate our losses.
That still won't pay for a new cath lab, Frank.
Right. With 3 suites, our per lab performance is still going to be way underutilized unless we can fill the capacity. That's where my second recommendation comes in. We've been talking about purchasing the Oak Hills Clinic. Well, the projected referrals from Oak Hills are just what we need to bring our volume into line with another suite. Now, we'll solve 2 problems. With the new cath lab, we'll cut our existing deficits. And with the new clinic referrals, we'll pay for the new lab within 18 months.
You make a good case, Frank. Can I borrow your report?
Can you rest now, hon?
Yeah,
Mr. Daniels in 3C is better this evening. He had an episode of VTAC this afternoon that we resolved with cardioversion at 50 joules. You see his ST segments are way down, and I've got a call into Dr. Armani about the PTT. All in all, he's looking pretty good.
Well, okay. I'll see you Wednesday.
See you then. Night.
Ready for a report?
Sure. How's the little girl on 137?
Emily, her family's had a hard day, but it looks like she's responding now.
Well, support system is working well. Labs look good. What's next?
A quiet night, I hope.
Hi, Tom. We just did a new liver function test on Emily Nelson. And good news, I think we caught this thing in time. She's doing so well, I canceled her listing for a transplant. I'll fill you in tomorrow.
Hi, sweetheart.
Hi, Mom.